I'm joined by Katarina, Executive Vice President of Sustainability and Chief Compliance Officer at AstraZeneca. Katarina, thank you for joining me today. Let's jump straight into the first question, which is quite simply, what is the message that AstraZeneca are trying to convey this year?
So although we have been consistently working to make our company more sustainable for many years, our planet is now at the crisis point, and we all know that. Climate change represents an urgent threat to public health, the environment, and the sustainability of the global economy. So we really want to use our voice to help drive more ambitious climate action, particularly for the healthcare sector. It generally takes around 10 years to bring a new medicine from early discovery in the lab to being accessible to patients. So if pharmaceutical companies like AstraZeneca don't actually plan and make decisions with the long term in mind, we won't be able to deliver new medicines to help patients in the future. And we have seen the healthcare industry brought into sharp focus by the COVID-19 pandemic, primarily related to public health and social issues as well. But there is also a key role for the sector to play in achieving a green recovery. We're currently the only pharma company to be a member of all three EV100, EP100 and RE100 climate group initiatives. And we were one of the first joining RE100 in 2015. By more healthcare companies participating in these types of initiatives and commitments, we send a signal to the market to drive better infrastructure and investments to realize these goals. And with the Lancet Commission citing climate change as the century's greatest global health opportunity, we as a healthcare sector need to make actions across all our activities and products to contribute toward a healthy planet and healthy people.
So how have the events of 2020 changed how you are confronting climate change?
The climate crisis continues to impact the health of communities around the world, so the emergence of COVID-19 has increased, not reduced, the urgency of our action on climate. The World Health Organization estimates that nearly 13 million people die every year from environmentally related health risks, including 7 million people from air pollution alone, making it the second leading cause of non-communicable disease deaths worldwide, being behind tobacco smoking. We recognize the contribution to health system resilience that action on climate will make, including by reducing the prevalence of non-communicable diseases, such as respiratory conditions, for example, that directly impact on patients' ability to combat the virus. The science is clear, we cannot wait. The Earth's climate is now changing faster than at any point in history, primarily as a result of human activities. We must work together across sectors and governments to address the connection between the health of the planet and healthy people.
And in terms of this week, obviously you're part of Climate Week NYC. The whole year has changed. COP26 was going to be a few weeks away. Now it's going to be a few months away. From your point of view, how does collaborating with events like Climate Week NYC help you maintain momentum at AstraZeneca?
So at the main international climate summit, being this one in the Climate Week coming up, we see that as a key opportunity to help raise the profile for important environmental issues as part of our company's focus on sustainability. So cross-sectorial and public-private partnership will be key to help us deliver our bold ambition to become carbon zero by 2025 and carbon negative across the entire value chain by 2030. In many parts of the world, there just isn't the infrastructure to deliver this yet. So we need to work together across industries, governments, science, and academia to support companies and countries to take bolder actions and to be able to deliver on them more quickly, as well as working together to shape the health systems for greater resilience in the future. And our collective response to climate change over the next 10 years will define health and wellness globally for generations to come. And we do not have the next 50 years to make this difference. The time is now.
And you mentioned the future quite a few times there. When there are so many other priorities going around, do you think the broader sector has that sense of urgency? And how does AstraZeneca cope with that sense of urgency in terms of the initiatives that you're discussing this week?
We cope with the urgency in the way that we really have set targets that are science-based targets and that are pretty tough targets, so that we contribute, make sure that we drive our own impact on climate with our own operations, but also address the whole value chain. And I think we influence each other as companies, and also collaborating with governments and academia and others. If we are more that set high targets, I think we're going to move faster.
And obviously, this is a week that brings together so many different organisations, leaders from government, leaders from business like yourselves. What role does collaboration play in coming up with new ideas or maintaining that momentum?
Collaboration is hugely important, and collaboration is actually important in the pharmaceutical industry to begin with because of innovation. It's an innovative driven organization and area. So collaboration is the most important thing. And that, I think, is also why this climate summit is so important, because this is where we come together from many, many different stakeholders.
Brilliant. Well, really look forward to seeing your event, which is going to be on the Facebook Watch all through the week and beyond. And Katarina, thank you so much for taking the time out to speak with me today. Really appreciate it. Thank you so much.
Thank you.